Hello from EULAR 2022, day 2 of the conference. I'm coming in virtually from New Jersey, and today I'm going to talk about one of the abstracts that caught my eye that I've been following here with Room Now. We've got oral presentation 0138. This is a study coming from Spain looking at cancer risks on biologic and targeted synthetic DMARDs. Particularly, it's looking at patients with a history of malignancy in the past and evaluating their risk of recurrent or new incident cancers. So this study looks at the BioBattiser registry from Spain. And again, these are all patients that have had a malignancy in the past and are now being started on immunosuppression. Obviously, malignancy is a big topic of interest for many of our patients. And especially in these patients with a history of it, and these would have been patients that were excluded from the clinical trials. What they compared specifically is there a difference between the different agents of biologic and targeted synthetic DMARD therapies? They looked at 352 patients with a prior history of malignancy. These patients were 70% female, mean age of 65 years old. 94% had history of non-lymphoproliferative malignancy, such as solid or melanoma cancers, and 8% had a lymphoproliferative malignancy. 2% of these patients had prior metastatic cancer that were felt to be in remission at time of starting DMARD therapy. Of these 352 patients, unfortunately 32 developed a second incident malignancy, 17 solid, 14 non-melanomatous skin cancers, and 1 melanoma. The rate calculated of a risk of cancer was 27 per 1,000 patient years. When they compared across all medications against TNF inhibitors, there was no significant difference on all of the therapies when compared to TNF. So they looked at JAK inhibitors, CD20, IL-6, CTLA-4, and IL-17 inhibitors, comparing against TNF inhibitors. And again, no significant difference to show any difference in malignancy risk in these patients when compared to a TNF inhibitor. It is worth noting there were some non-statistically significant differences. There was a numerically higher rate in CTLA-4 with 5 of 47 patients being diagnosed with a malignancy, or this is 52 per 1,000 patient years. This was not statistically significant. And also worth noting, there was no difference in cancer types or mortality that was noted. So I think there's lots more questions that I hope to learn when we see the eventual paper about cancer types, breaking down, are these truly new incident cancers, or are these relapsed malignancies that have been in remission? And a little bit further analysis of these different cancer types I think will be interesting. So I'm hoping to see a lot more information on this, but I think this is very useful data, very relevant data for many patients. And it is worth noting that from what we have thus far, there's no evidence that there's one drug that increases or decreases the risk of recurrent cancer in patients that had previously had a malignancy. Lots more information from EULAR 2022. Check out Room Now for all of our coverage, and have a wonderful rest of the conference.